Today I'm at Ponte Vedra Vein Institute and we're going to be talking about vein disease. So let me introduce you to Dr. Megan Deacon-Casey. She is a vascular interventional specialist and physician assistant Crystal Boatwright. Good to see you ladies again.
Thanks for having me. Good to see you.
Yeah. So let's get right to it. What exactly is vein disease?
So vein disease is when you have venous reflux or chronic venous insufficiency. This is when you have backflow of blood from the heart down to the legs. With that, you get increased volume in the legs. You get increased pressure. And over time, what happens, you'll notice veins that bulge above the surface of the skin, such as varicose veins, spider veins, patients will notice commonly. And then patients will get lots of symptoms. You'll notice skin changes as well. And patients describe that, they just don't understand why their legs feel the way they do, but it's because of the venous reflux that's happening in their legs.
Interesting. So let's touch more on the symptoms. Crystal, can you tell us more?
Yeah, absolutely. So patients will feel heaviness in their legs, fatigue, cramping, restlessness is a big underlying complaint, swelling, and skin changes like Dr. Casey said. And a lot of times they go unnoticed because we're really good at trying to figure out, well, my legs must feel like this because I did this activity, when really it's this underlying vein issue.
And I'm glad you said legs specifically, because when you say restlessness, I was going to ask, do you mean restless leg?
Absolutely.
Not just, I'm restless. No. Maybe that could be something else, who knows? But let's talk about this then too. Who can develop it? Because this is all inclusive, right?
Absolutely. It's very prevalent. Women are more prone to get it, but men do develop varicose veins as well. So if you have a family history of varicose veins, swelling or skin changes, ulcers, you're more prone to it.
Interesting.
If you've had multiple pregnancies, that puts you at a higher risk.
Okay.
Occupations where you sit or stand for prolonged periods of time also puts you at a higher risk.
When you hear all inclusive, you typically like the way that sounds, but not in this situation, right? Okay, so let's talk about treatments then. What is offered? What's available?
So multiple treatment options for venous insufficiency and chronic venous disease. Over 40 million people in the United States have this disease problem, yes, but only 1.9 million people actually seek treatment for this. So it's very, very common. And what we do, once you come into the office, we'll do the complementary ultrasound screening. Then we'll move on to a diagnostic exam where we're coming up with that individualized treatment plan for you specifically. And then once we've decided what you need, then we'll treat either by using radiofrequency ablation versus laser ablation, phlebectomy, which is removal of veins if they're larger varicose veins. And then we can do spider vein sclerotherapy treatment for the cosmetic improvement for patients. So, we typically put patient on a follow-up plan as well, because venous insufficiency is not something that we're curing for patients. We're definitely managing the problem, but what we do is that once you come do the follow-up plan, we'll identify new vein disease or new veins that are starting to reflux, and then we can treat you at that time again.
Yes, want to be proactive.
Absolutely.
Okay, so you've got 2 locations. Tell us how they can get in touch with you.
Yes, 2 locations, one in Ponte Vedra Beach and one here at the Gate Parkway location. And then you can reach us at 904-280-0600 or at our website at www.pontevedravein.com.
All right. Thank you, ladies, so much. I feel like I always learn something when I'm here.
Of course.
And thank you for helping us, too.
Thank you.
And if you'd like to see this interview again, just head to our website at firstcoastliving.net.